My name is Bill Yarber. I'm the Senior Director for the Rural Center for AIDS STD Prevention at Indiana University. And today I'm talking with Jill Waibel, MD, who is the recipient of the Ryan White Distinguished Leadership Award. Congratulations. And this event is actually the 20th anniversary of the death of Ryan White. This is a remembrance, celebration of his life. And part of that event is that we awarded the Ryan White Distinguished Leadership Award to Jill. And I'm using this opportunity to talk with her. And certainly the major impetus that we awarded this honor to her was the fact that she founded the Indiana University Dance Marathon, which is actually, I guess, the second largest dance marathon in the United States, and has raised over $8 million for the Ryan White Infectious Disease Center, and also at the Indianapolis at the Medical Center at Indiana University. But also we recognized her because of the fact that she was very instrumental in Ryan White becoming accepted and feeling safe at Hamilton Heights High School in Cicero, Indiana. And so I want to ask you some questions about all that and how all that started and how you got involved and so forth. Jill, how did you learn that he was moving to Cicero?
Well, you know, we were all very aware of what had happened to Ryan in Kokomo, and then how I personally learned was I got a phone call from the superintendent. I was this incoming student body president, and I thought that was strange that the superintendent would call you in for a meeting, because I was thinking I would be in charge of homecoming. And
sure.
And I went into school about a month. That was the summer before my senior year and before Ryan had moved in. And Tony Cook, our principal, and our superintendent, and a few others were at the table, and they said, you know, Ryan White is moving into our school. And that was the first I'd heard of it. And then not too long after that, Jeannie and Andrea and Ryan moved into our neighborhood. So
wow.
Yeah.
Yeah. And so then at what point did you sort of actually get involved with Ryan then? After he moved in, and you know, what was that first initial?
My mom and dad said, we're taking the new neighbors some cookies, or, you know, I mean, it was just, that's how I was raised,
wow.
You know, in Indiana. And
sure.
we went over and knocked on the door, and we were welcomed into their home. And
good.
I think that we had a special connection with,
sure.
I mean.
Right away, maybe.
Right
yeah,
away.
Right
Right
away.
away.
Right.
And then it became evident, again, you know, as I reflect back 20 years later now, at the time you don't realize what's going on, but, you know, everyone was afraid of AIDS. But, of course, we had a couple of years on Kokomo. You know,
sure.
a lot had happened in that 2 years, educationally speaking. A lot more cases were being recognized. The science had moved forward quite a bit. But Indiana kind of took it upon ourselves to be a leader in the country, and the former Governor Otis Bowen was at Health and Human Services in Washington, D.C., was working closely with Woody Myers, who was the Indiana State Medical Association president, who was working closely with our school. So it was very well thought that we are going to educate the children and have the children tell their parents.
Sure, right. Educate them, right?
Yeah, which, you know, that doesn't, we rely on parents to educate their children.
Right.
And in this instance, the thought was, let's see if we can stabilize the youth first, which was really quite amazing.
And did it work?
It worked. It was beautiful when, I think we had about 2 weeks where we had nothing but AIDS education in our school, speakers and all the kinds of things that your department does here.
Sure.
And then when Ryan came to school, there was, I think, one dad that came, and the child looked his dad in the eyes and said, "Dad, I'm staying." But other than that, everyone was so excited to have Ryan there.
Wow.
Yeah, I remember football players would carry his books, and you know, it was.
So it's a very, very different experience, of course.
Yeah.
Different time, a little bit. The time had gone, moved.
So I think everything was in the favor, and the education certainly was very powerful.
Yeah, good. So, but of course you became friends, and you spent, you know, time with him, and you know, took him to school in the car and so forth. I mean, I guess, you know, there's neighbors that move in, and sometimes people get involved, and sometimes they don't. Why did you get involved with this situation with Ryan, and you know, what occurred there? You think that opened that up to you?
you know, to this day, I think Ryan's still one of the most inspirational human beings I have ever met, and you know, his mother as well. They to be around them, you're drawn to them, and they're good human beings and they have good values. But you know, I just think Ryan, it was just a natural friendship on some level. I mean, Ryan is charming and he was eloquent, and I was very impressed that here's this young teenager who just carried this incredible burden between the hemophilia and the AIDS and the stigma associated with the AIDS at that time, and he just made it look effortless. I mean, he knew that he had to wake up every morning and help the other people in the world with AIDS, and he recognized the ignorance for what it was, and he didn't have a mean bone in his body, and I think, and he never complained. I don't think I ever heard Ryan complain. No, and he had this really amazing sense of humor. And
I mean, do you remember recall anything that was humorous, or just off the top of your head, or not?
Well, I mean, one of the funny. I mean, I have many funny stories. I mean, one of our favorite was there was always press at our high school because you know it was the first high school in the country to have someone with AIDS go to school. So Ryan and I would try to sneak into school without the press seeing us. So sometimes we'd drive to school, park 3 blocks away, go running through the bushes, run into school. You know, I don't know if I should tell the car one.
Yeah, go ahead. Okay.
Ryan wouldn't want that one on.
All right. Okay. Sure.
You know, he was just. I mean, you spent more times laughing with Ryan.
Oh,
he loved Chi-Chi's Mexican food. That was his favorite restaurant.
Wow. Yeah. So, when you became friends with him, and you know that friendship grew, I guess by what you just said, your family was okay with it. Is that true?
Yeah, I mean, I think Ryan definitely had a core group of friends. I think, you know, Ryan and I, you know, we were friends, and definitely we had the neighbor relations. But you know, he and I were also in many, I'm going to call it professional situations where he was nice enough to ask me to go to several of the traveling events, and you know, I went to testify in front of Congress with him, and so we often had serious discussions too. I mean, we talked a lot about why he was doing this, and the answer was always that he wanted to help other people. Sure. We had a lot of talks about life and death. We had a lot of talks of you know, his family and his mother, and so there was a very serious, also thought-provoking side of Ryan, and I think he and I shared a lot of that because we were doing these things nationally together, and so we had that kind of a connection too.
Wow. And you were 2 years older.
I think 1 year older.
Or 1 year older in school, but not the same class. Yeah. You were a sophomore and he was a freshman, or when he came, or was it the other?
When he came, I was a junior, but I think Ryan, that 1 year, there was a couple with his sickness, so we had to stay away. Yeah, we were probably officially my birthday's late April, this is December, so I think he's officially probably 2 years older, but with the way the birthdays fall, and then I was the junior and he was coming in.
So we had a lot in common relative to maybe the way that personality, maybe the way you looked at the world, and you know, some of your life principles, and that probably just really helped you connect in a natural way.
Yeah, very much so. And he was such a leader and so very charismatic. You know, when you hear people say someone's charismatic, and
he was. Hey?
He was. I mean, when you walked into the room, or you were just drawn, and he was a very quiet, you know, just power, just in, you know, standing there, and people were very drawn to him.
Wow. He must have been, you know, really appreciative of course, your friendship. Did you lose any friends? No. Or have any negative things from this?
No. As a matter of fact, I've always felt guilty. It was an amazing experience for me to go through. It really changed my life. You know, he was an inspiration for, you know, how to be a good human being. And, you know, such a terrible thing was going on with him and his family. And I've always felt so blessed that I got to be part and to know Jeannie and Ryan. It's, it was an amazing time. And to see a disease, especially now that I'm a physician, to see a disease unfold like that, you don't get to do that very often. Of course not.
I mean, it's firsthand like you in that kind of situation, as a friend.
Yes, and to live through that new disease. And then as a doctor now, to know that we've made it a chronic illness, we haven't cured it, we don't have a vaccine, but we've come so far medically, and it's just unfortunate we couldn't give that to Ryan.
Oh, wow, yeah, that's true. I'm sure you have so many memories. I mean, maybe it's hard even to, you know, select just one or two, but any sort of special situations, circumstances that you would like to share?
Well, one of my favorite was, I think one of our busiest days was the day we went to testify the Congressional AIDS Commission.
Mm-hmm.
On, Ryan was talking about his experience, and then I was talking about how we dealt with it from our school. And Ryan hated public speeches. He was such a mess, in a good way, but so he didn't want to get out of bed that morning. And I think Jeannie and I had come into their hotel room, and so he was like, "I'm not going." And we just laughed but then when he would get to these speeches, he would just nail them. He was beautiful. Probably our worst experience is when we were on Nightline together.
Oh.
It's very, very intimidating. And when we went, Ted Koppel was very nice, but they put you in a dark room, a black room, because they don't want one guest if somebody's like in California and somebody's in the studio. So they put you in a black room that's about 90 degrees hot. They put a headphone on you, and they shine a light on you. And so Ryan was in a room, I was in a room, and Ted just was singing the zingers towards Ryan. And I remember, but it was also an amazing experience. But that was a tough day.
Wow.
And that all happened like in the same 24, 48 hours.
Oh, is that right?
Yeah.
So, any of these times, did he rehearse what he was going to say, or you guys talked about maybe important points?
A little. He did spend time writing his speech, but most of the time he knew. He spoke from the heart. He knew what he wanted to get across. He didn't enjoy doing the interviews, but he was very passionate to help other people and to help other people with AIDS, to prevent the suffering and to educate people. Yeah. He had been the victim of so much,
of course,
many horrible things at the hand of ignorance and not understanding.
So even though this was an era community that was much more open and accepting, did you witness some really tough situations on like harassment or anything similar?
We really didn't have it. It was like a
very different.
It was a very, and again, I think we had some time to deal with. By then, AIDS had been defined, and we understood. No, I really don't recall any
that's great
negative things in our community. Certainly there were still some things going on in the world.
Exactly. Yeah.
But I think, and at that point too, Ryan just was doing so much for the AIDS world and the AIDS community.
Sure. And people knew of him, and they just realized finally what it's about. Yeah.
Yeah, and I think when people saw Ryan, it really did change how they felt about AIDS.
That's understandable.
There was
his
so
personality.
Much fear, and we understand that now.
Sure.
People were afraid of this horrible disease. It is a horrible disease.
Of course. Yeah. And so that explains a lot of that in a lot of ways. And they didn't know how to react, and that's one way they would respond.
For their life,
of course.
And their families.
Exactly. Yeah.
It was one of the first diseases we had seen in the United States in the current times that was lethal.
Yeah. Sure.
And
very quickly also.
And it was contagious.
It was a
communicable disease.
Sure.
We didn't completely understand how, but
at first, but then So tell me a little bit about the IU Dance Marathon. How did you get that going? How did that idea even emerge, or why did you even feel like you needed to do something?
Well, it was really I had just driven home from Ryan's funeral, and as you know, he died on April 8th, and his funeral was a couple weeks later, and it was almost finals here in Indiana, and I was a sophomore.